This program is brought to you by Emory University.
One of the great benefits of Emory is the breadth of clinical exposure we have here. At Grady, we have a level 1 trauma center. We have Eggleston, which is a freestanding pediatric hospital. And then we have EUH, which is a quaternary care center. In addition to that, we have multiple other suburban and urban hospitals throughout the city of Atlanta.
I wanted a residency program that was a tertiary care facility, that was an academic center. I saw a lot of different pathologies in a variety of cases. But what really stood out with Emory was the culture of Emory. Dr. Mullins and Dr. Ho instill a great environment, a team-oriented environment that makes you feel like you're part of a family rather than just another residency program.
This is a place with immense opportunity. So I think a resident can be as good as they can be, so achieve their full potential. I think that's pretty rare in today's world, and I like the idea that we work on that here.
We have a unique integrated transitional year opportunity for our incoming radiology residents, which allows them to rotate through core radiology electives prior to becoming a first-year radiology resident.
The main reason I chose to do my transitional year here at Emory was because I didn't want to move twice, which is a simple reason, but once I got here, I was really glad I made that decision. It allows you to kind of get involved in the Emory system during your first year, get to know people from different services, people in the emergency room, people on internal medicine, so that when you make your transition to your radiology residency, you're kind of already involved in the Emory system and know different people. It's fun to call your friends with reports and let them know what's going on with their patients once you're on the other side.
Our residents get the opportunity to work closely with subspecialty clinics at the Midtown campus and see a wide range of pathology and trauma at Grady Memorial Hospital.
One of the greatest assets of our program is the unique case mix that residents encounter on a daily basis. We rotate through both inpatient and outpatient settings, and also get to rotate through tertiary care hospitals, both adult and pediatrics, as well as our county hospital.
We have amazing faculty-resident relationships, and our faculty are world-renowned in every subspecialty, and doing so allows a resident to have amazing subspecialty clinical training, and also allows them to do research in all realms, whether it be quality outcomes or clinical basic science research.
Our faculty is outstanding. We have these world-renowned attendings that are leaders in their field, and we're reading out with them kind of on a first-name basis, and they know what's going on with their life. They ask about your family, and it's just an interaction that I really enjoy.
We had several residents during the last few years who got the RSNA grant, and I joined them this year by getting this grant. We have nationally renowned faculty members at Emory who helped me from the time I started my residency here and taught me the basics of the research and showed me how to do research during the last couple of years.
We have several programs that our residents have participated in here at Emory, one of which is the Adoptive Resident Program, where benefactors donate $10,000 and our residents compete with each other for trying to get that grant. So some of them had ideas around things like teaching anatomy to medical students, interruptions in clinical workflow.
The Adopt a Resident Research Program offers residents at Emory a very unique opportunity to pursue non-traditional areas of research, whether it be in informatics, health policy, or quality improvement. I picked a project looking at multitasking and interruptions in the reading room, as this affects every radiologist in their everyday practice.
You can do whatever you want in Atlanta. There's always something to do. There's great food, there's a great social scene. But if you just want to go and sit back and relax, there's Piedmont Park right in the heart of the city. They also have great sports teams. I'm a huge sports fan.
I love living in Atlanta even more than I thought I would when I moved here. It has everything a big city would offer, but it's really a series of neighborhoods, and each little neighborhood kind of has its own personality, its own feel, and there's a ton of green space, so you can do anything kind of you want outdoors while staying inside the city.
I did my residency here at Emory and then stayed here for my fellowship. After that, I went out into private practice. But when I decided I wanted to come back into academics, I knew that the place I wanted to return to was Emory. because of the great environment we have here and also because of the opportunities.
Again, I think our residents are very well trained. I could be biased about that, but I think that's true. And I think they can handle volume and complexity, can run a service and can start on day one. And as you can imagine, I think that that's a very marketable person in general.
One of the main reasons I chose Emory, I think, is its size. That was attractive to me because you get to travel to different locations, see different workflows, different patient populations, just kind of different ways of doing things, which I think will prepare you for any kind of a job when you leave here. You're kind of ready to handle anything.
The preceding program is copyrighted by Emory University.